Welcome back to the Chad Hasty Show, News Talk KFYO. Joining us on the phones right now to talk a little bit about coronavirus. Great friends over at the Texas Public Policy Foundation. Vance Ginn joining us, the chief economist over at Texas Public Policy Foundation. Vance, welcome back. How are you today?
I'm doing well, Chad. How are you?
Doing great, and we're glad to have you on, and glad that we're on the air today to have you on. I know you've been very active on Twitter, really taking a look at the numbers behind the numbers. You know, you've got the media, which will send out sort of those top line numbers when it comes to coronavirus. You and the folks over at the Texas Public Policy Foundation, y'all been kind of looking deeper into the details, correct?
Yeah, that's right, Chad. I mean, we really wanted to provide full context of what's going on across the state. And normally what you'll hear in the media, and a lot of the talking heads will be, cases are going up. And that brings up a lot of fear. And, some of that's rightfully so. We need to be worried about the cases, but we need to figure out what does that actually mean. And unfortunately, what we find is that the data it's really scarce. We need more data overall. When you look at demographics, when you think about the number of people potentially crossing over from Mexico, when you think about the death rates, and ultimately what's most important is, remember flattening the curve back in the day was to make sure that we didn't overwhelm hospital capacity, and now it's been about getting cases to zero or deaths to zero, which we would all love that for that to happen. But ultimately, look, hospitals still have a lot of resource availability really across the state.
Well, and that kind of flies in the face of what we're hearing. You go to, let's say Drudge Report today, or just about anywhere else, it's, Texas hospitals running out of space. And they point to, I think, some of the border counties. They point to Houston. And I remember that when Houston was about to be overrun. And then even in Houston, the doctors had to come out and go, no, we're doing just fine. How is the hospital situation really in Texas?
So, there's a lot of good sources that are out there. Texas, the SHS, they have some good information. Also, Texas 2036, I kind of like the way that they put up their data. But they show that there's across the state beds availability. There's 20% of beds available, 14% of ICU beds available, and 61% of ventilators available. So, I mean, there's a lot of resource availability now in some areas, like Houston, for example. It's closer to 10% of ICU beds available. But one thing that we often don't hear is that hospitals usually have about 90% of their beds full at any point in time, much less when coronavirus, COVID-19 is going on, because it's profitable for them to do so. And so they can shift patients around. They can, have them the appointment set on certain dates to make sure that they bring in those people whenever they need their procedures and things of that nature. But you often don't hear that. You just hear, ICU beds are at 90% capacity. Well, that's pretty typical.
Right, and I think that's an important point, is that, you compare year to year, and you have most doctors and some of the staffers who are saying this is what we're seeing as normal. Year to year is normal. And you're also not seeing what we saw back when this first began, which was every major city in Texas was coming up with ideas for a temporary hospital. Are we seeing any of that, really come back in Dallas or Houston or Austin or anywhere else?
I haven't seen that. And in fact, hearing and talking to hospital CEOs, and you can read some of the stuff they put out recently, is saying, look, we're able to manage these sort of things. They do a lot of training dealing with crisis management. Just think about along the coast when they have to deal with a hurricane that comes through. I mean, there is a lot of availability of resources around the area to transport patients that need it. Now, look, some hospitals aren't taking COVID patients because they're trying to isolate those from the other patients that they would normally get. So that reduces some of the availability of where the coronavirus, the COVID-19 patients would go. But there's still a lot of other beds that are available. And, what's interesting, too, Chad, is I was looking at this morning on the latest numbers for there in Lubbock. And, of course, I love Lubbock. I went to Texas Tech. I got my PhD in economics there, so I'm a Red Raider. And I was looking at the numbers, and they didn't show cases for 3 days in Lubbock County over the 4th of July weekend. And then, of course, on on Tuesday, they came out with 298 cases. They just dumped them all in one day, and then 133 the next day. And so we started to say, all right, well, cases were up 10,000 on Tuesday, but there was a huge dump of cases all on one day. Yeah. And so we've got to consider how all these data sources are being put out there to have full context of the situation.
Yeah, absolutely. Let's talk a little bit more about something that I brought this up last week because it's not being touched on a lot by the media, and that is medical tourism and those who are coming across the border, mainly illegally. Coming across the border and getting help in Texas border counties. How big of an issue do we think that may be here in this state?
We think that it could be a pretty substantial issue when you look at the numbers. When you look at the numbers of how many people are the increase in cases, hospitalizations there along the border, would indicate that something is going on, that there's definitely more spread, contagion, deaths are increasing there as well. But the problem is, going back to one of my earlier points, is that we don't have good data.
Yeah.
We don't know whether or not these are folks coming from Mexico, if these are Texans. It would also be helpful to understand who's in hospitals, age groups. And it's just unfortunate that we're not getting that data to really be able to assess what the situation is. And ultimately, we need that data to make good policy. That's been one of the frustrating things throughout this, Chad, is really getting the data that we need because different policies are being made, and for example, down here in Austin, they're meeting today, the city of Austin is, to consider a 35-day lockdown. And it's like, okay, what data are you using?
Right.
And who are you trying to help along the way when we know that lives and livelihoods will be at stake if that happens?
Okay, now help me out here. When we go to the policy, because this is you're going down the road I was about to go down, which is policy. With the governor's executive orders, his executive orders basically say, I overrule everything locally, that it all has to come through me. How does Austin shut down when the governor says you can't shut down?
Yeah, I mean, it's something that's going to be need to be
or
looked at.
Or do you think the governor's going to give his blessings for it?
Well, I mean, the governor did release an executive order yesterday, or maybe it was a notice. I don't think it was an executive order, but basically a notice saying, look, the city of Austin should look to see what's in their best interest. Now, I don't know what that means, if he's going to come out and say that it's okay for them to do a lockdown or just giving them some insight of where his thinking is. I do not know where Governor Abbott is on that. But we're hopeful, here at the Texas Public Policy Foundation, that we don't have another lockdown here in Austin or really across the state.
Yeah.
As you know, Chad, over the last year, I had the great opportunity to go work at the White House. I heard earlier Brooke Rollins is going to be on the show, but I was there as the chief economist of the Office of Management and Budget. So I was working at the White House, and it was interesting being there during this whole COVID-19 situation and looking at the data and what was happening. And it wasn't the White House, the president, who was shutting things down. It was the state and local officials. And it was like, look, what we really think is we should be giving out guidance, which is what we did, and let them decide, kind of the federalism. But the problem that we've seen with that is that the cure, right, the lockdowns and things of that nature, have seen much worse than the disease, where many people have lost their jobs, their livelihoods, their businesses, and it's really a hurtful situation that we've got to be able to consider. I keep saying this, but the full context of the situation.
How do you think the governor is handling this policy-wise?
I think he's looking at all the data and getting feedback from his strike force, and it seems to be doing what he thinks is in the best interest of Texans, and I hope this works out for the best. But what we're really asking for is to make sure that we are being provided all the data. We really need to know what's going on along the border. Who are these people that are in these hospitals they don't have to share information. Look, we understand HIPAA rules and guidelines, but it would be nice to know the demographics of these folks, so that way we could also consider, in our research and our policy advice here at the Texas Public Policy Foundation, to give good guidance to the governor and other policymakers across the state.
Yeah, absolutely. I'm with you. I'm one of those who believes, I'm right with you. The more data, the better. And it can now. There are some folks who just want to scare the hell out of everybody. You do have that group, but the more information that you put out there to folks, the better it is. Let me ask you this: do we know? Knew somebody who lives in the Tyler area, who they had gotten a positive. Okay, a week later they weren't feeling bad or anything. They went back, they got a negative. And so they tested positive the first time, tested negative the second time. How is that counted in the overall count? Is that a positive or is that a negative, or do we know?
From what I understand is that each one would be counted, right? You would have a positive count, and then you would have the negative, and then that would go under their positivity rate, which has been pretty high here recently. But, there are also reports like down, here in Austin and San Antonio, where they started to resort to just testing those who are symptomatic again.
Right.
And so if you do that, again, full context for the situation is you're going to get a higher positivity rate. And look, if the case numbers are going up, which we've seen that they are, okay, if these are younger populations that are healthier and things of that nature compared to where we were a month or two ago, then you have a fewer hospital stays, or at least shorter hospital stays. If you're someone that's in your 20s and 30s, the average stay is about a day and a half. Compared to 50s and 60s, you're in there for 4 or 5 days. So you have more of this rotating where people are coming in and out. It also means that if we have a younger population with these cases, then there should be a lower death rate, which is what we're also seeing, is that death rates have started to fall over time as well. So there's been this trade-off between higher cases, but also because we're testing a lot more. We're almost testing 50,000 people a day across the state. And then deaths are also, in general, have been falling. There have been some updates here recently, but in general have been falling.
Yeah, absolutely. Vance, we appreciate your time today. Thanks for coming on. How can people find out more about the work you're doing and the folks over at Texas Public Policy Foundation?
Yeah, well, thank you for having me on the show. We're at texaspolicy.com. You can also follow us on Twitter at TVPF or me at Vance Ginn.
All right. Very well. Vance, thank you very much. Always a pleasure to visit with you. Let's visit again soon.
Sounds good. Have a great day.
That's Vance Ginn with the Texas Public Policy Foundation here on the Chad Hasty Show, News Talk KFYO.